Hey gang, this is Bipolar Bear, and this is my introduction to my video blog about severe mood disorders. And I want to talk a little bit about me and what this video blog's going to be about, why I'm doing it, and what my expectations of myself and participants will be. Let's start on talking about me. 27 years old. I live in Pittsburgh, Pennsylvania. American, born here. So if you're overseas, you're welcome to participate as well. I've been struggling with mood disorders since about 8th grade and was officially diagnosed at 16 with a more severe diagnosis in my early 20s. And I want to show a pattern and see if there's other people out there with this pattern. And the pattern is severe mood disorders that appear to be relatively treatment resistant. And by treatment resistant, I mean the normal treatment that most psychiatrists and therapists would give. You don't get a therapeutic response. You still continue to unravel and bounce back and unravel and bounce back and unravel. And this is not to say that with a mood disorder, treatment's going to wipe you clean of all your symptoms. But treatment should get you to a semi-functional life. I started out with a diagnosis of major depression, and I spent a lot of time in mental hospitals and outpatient treatments and therapy. I've been going to therapy for over 10 years. I've probably been in mental hospitals of my adult life, probably about a year of it's been spent in the hospital, more in the adolescent side of things. And I played musical medicines many times, and the last psychiatrist I saw in a partial hospitalization said something interesting. I didn't agree with everything she had to say, but I did really have to agree with her on this one. She said, "You know what? I think that you're really a medication-resistant patient. I am on Seroquel, a small dose, but seems like everything I try agitates me, makes the situation worse, far worse. And if you've been on these medicines, you know they have rotten side effects." I have had success with Seroquel and some other medicines, but you've got to weigh your options with these, and you need to talk to your doctor. One thing that I also want to say about this channel is I'm not a professional. This is like a support group, like you're going to, with other patients. I'm not a professional. I don't have a degree in psychology. But I do have a lot of knowledge about making it, making your life livable, because it can be so rough, getting fired from jobs, not being able to date or have a serious relationship. Another thing about me is I happen to be gay, and I'm just including that because it's about who I am. My family's very accepting of it. Of loving parents, come from an Italian family, and they get that part about me. They really get that part. Not a ton of questions about me being gay, but you know what they don't get? They don't get the mood disorder at all. They don't understand it. They don't understand why I have to be on medicine. They don't understand why I have to go to therapy. They think, I've got it semi under control. I got a good support system, but my family has, they know when I'm sick, but they don't know that I'm a bipolar with panic disorder and borderline personality disorder. And doctors have asked them to get involved, but it's difficult for people. And these videos are really also for not only with patients with mood disorders, but also people who have family members or friends with a mood disorder. And I hope this helps you. I'm gonna always check in with my mood, and today was a prime example of what the day in the life of someone with a severe mood disorder. Very elevated today. With a mixed episode. So a mixed episode means was fairly active, awake, not wanting to nap. But a mixed episode means that there's a lot of negative feelings with that mood. It wasn't halfway through the day that I had a nervous breakdown and started with my suicidal ideations. And started crying. Once I cried, I felt better. Went back to work and chalked it up. But most people don't have that roller coaster in a day. And I was so excited. I started journaling like crazy, setting all these goals of how I'm going to make my life all better. And then I sort of kind of burned out at this point. And I've been thinking about making this YouTube weblog or channel. And, if you know me, you know who I am. Don't pass this on to people that aren't going to learn from this video, people that want to make fun of me. This takes guts. This is not an easy thing to do, to put yourself out there on the internet. But I want to help people. And I think, I'm a computer programmer. And the time when I learn the most about working with computers is when I help other people learn about computers. Help them write their computer code. I sort of reinforces my skill set, and the same thing goes with these videos. The more I sort of talk about what's worked for me, instead of groveling for help in front of the psychiatrist or the therapist, hopefully it'll reinforce those skills that I do have that help me stay afloat, help me help me get up and go to work, help me do my homework, help me have fun with my friends, date, all these things. Not to say that any of that's really that great in my life right now, but right now suicidal ideations are barely under control, and a lot of that's from despair, pain and despair that this is a never-ending pattern of defeat. And this video is also about people that have quite a bit of self-esteem. They feel good about themselves. They have ambitions. They want to do stuff. And that's me, and that's who I hope you are. And the despair comes from, setting these goals, doing the best you can, and coming up short again and again and again and again. And I used to get fired from jobs all the time. It doesn't happen right now. But right now, I blow a lot of money on tuition. We'll get into all that later, but yeah, it's a general despair that you feel. It's so unbearable that things are going to get better, or that they're going to stay better, more specifically, because with bipolar disorder or other mood disorders, things can seem better, and then you slip and you unravel until you feel like there's nothing left. You're so empty and detached. So we're going to be talking about some pretty heavy stuff, and may even be disturbing stuff, because who knows what's going on upside here. But I don't think they're not any thoughts that any other human being hasn't had before. So that's the introduction. And again, use this as you've been instructed. Don't use this for, as Bible. Don't, if you know me, don't tell other people. This is sort of semi-anonymous. So I wish you good mental health. I'll be back talking about the next topic. Gotta think about what that is exactly, but I could have 3 topics in a day, Got a lot of experience with this, 10 years in therapy. Sort of makes you mechanical in a way. That's all I have. Good mental health, as I said again. Bye.